Losartan is one of the most widely used medications worldwide, and I'm sure you've heard of it at some point, or perhaps you have a family member currently using it. Well, let me tell you that in this video we're going to talk a lot about Losartan and some interesting facts, and we'll answer some questions about this drug. So, welcome to this video about Losartan. First of all, what is Losartan? This medication is considered an antihypertensive drug prescribed for people with high blood pressure, which refers to hypertension. It also helps treat and improve symptoms such as chronic kidney disease and heart failure, and it's also used to prevent strokes and other diseases. There are many derivatives of Losartan. Perhaps you've wondered not only what Losartan is, but maybe you have a family member who takes Valsartan or Candesartan. Well, let me tell you that these are derivatives of the same family as Losartan, and they are also used to treat high blood pressure as well as being indicated for heart failure and acute myocardial infarction. These are the first guidelines we need to consider to understand what Losartan is, what Losartan is used for, and why people medicated for high blood pressure receive Losartan treatment. This drug lowers high blood pressure, reducing the risk of arterial blockages, which can lead to heart attacks, strokes, or blockages in other parts of the body. How does Losartan work in our bodies? First, once we ingest the medication, its action in the body is that the arteries in our body widen and dilate, allowing blood to flow much more easily. We know that in a person with high blood pressure, this mechanism of carrying blood through the arteries to different organs is impaired, forcing the heart to work harder to pump blood to the peripheral organs. However, people who take Losartan may experience less of this strain because it dilates the arteries, thus reducing the heart's workload. This significantly lowers blood pressure and helps prevent conditions like kidney damage, heart attacks, or strokes. How long does it take for Losartan to take effect? Blood pressure typically begins to decrease within 1 to 2 hours, but this varies from person to person as everyone's body is different. The drug's maximum effect generally lasts for a few weeks. Regular consumption is the reason why, if you are being treated with sartans, it is important that you maintain a consistent intake of the medication according to the instructions given by your treating physician. Here is a very important question regarding the drug. Should a person make lifestyle changes when taking sartans? The answer is yes. If you are already a person diagnosed with high blood pressure, you must make lifestyle changes even before taking the medication and also while you are receiving it. One of the first changes you should make is to reduce alcohol consumption, since this will increase blood pressure in the long term. Secondly, it is very important to quit smoking, since this will also increase the risk of cardiovascular diseases and therefore increase blood pressure. Physical activity is very important. A person who does a lot of exercise or simply moderate exercise greatly helps cardiovascular health. We also have to keep in mind that we must control the salt intake in food, since it is this is one reason why blood pressure can rise in many people in their daily lives, as salt is often present in lunch, dinner, and even some snacks. That's why it's always recommended to consume it in moderation. Finally, it's also very important to learn to relax and avoid stress, as this can also increase blood pressure. Many people wonder if Losartan causes cancer. According to scientific studies, clinical trials, and controlled meta-analyses, it was concluded that Losartan does not have carcinogenic components. You might wonder where this question about whether Losartan causes cancer comes from. It stems from an alert issued in June 2011 stating that Losartan increased the risk of cancer. This was because more than 100 batches of blood pressure medication contained the active pharmaceutical ingredient, which was a carcinogenic molecule. As a result, studies were conducted on people who consumed the medication. The blood pressure medication from that batch was compared to people who did not consume it from that batch, and the final result verified that sartan is not a carcinogenic drug. On the contrary, it is a completely safe medication. What will be the side effects or adverse effects that a person will experience after consuming a sartan? Well, Firstly, we have to keep in mind that some effects will be more frequent than others, such as dizziness. Dizziness generally occurs in the first few weeks after consuming the medication. What happens is that many people who take sartans often experience a feeling of faintness or lightheadedness when they stand up. For this reason, we recommend that when a person consumes a sartan and begins to experience this clinical manifestation of dizziness, they should rest and sit down. This is to prevent the person from suffering any kind of blow or trauma. Afterward, they can return to their daily activities. Another frequent clinical manifestation is hypotension. This is because we know that when a sartan is consumed with medication, what we expect from this medication is to reach a standard blood pressure level, but in many people, this clinical manifestation tends to drop lower than normal, even below the standard range. This is called hypotension. People with associated heart conditions will also experience irregular heartbeats. We must also consider hypersensitivity, as many people taking losartan may develop a skin rash. This is rare, but it can occur and usually disappears within the first week. Other infrequent side effects include leg swelling, palpitations, and fatigue. Why? Because when taking losartan pills, many of us expect to have normal blood pressure, but in some circumstances, it drops lower than normal. We must understand that normal blood pressure is between 120 and 130 and 80 and 85. We prefer it to reach this range because this helps prevent. If a person experiences other effects from taking the medication, and I take losartan, do I have to do it for life? The answer to this is yes. People who have been diagnosed with high blood pressure are taking losartan, and we know that this drug acts long-term. Therefore, its use should not be discontinued. That's why many people question their primary care physician and ask if their blood pressure is normal now. Why should I continue taking losartan? It's because if you discontinue the use of this medication, what you will cause is for your blood pressure to rise again. And when it rises, there is a much greater risk of the person developing blocked blood vessels, having heart attacks, or experiencing any other changes in blood pressure. That's why we have to keep in mind that this medication should not be discontinued, much less used for self-medication. What this means is that if a person, knowing that their blood pressure is within normal parameters, discontinues the use of this medication, at any time they want to make any changes to their losartan use, that's why we always recommend that you see your specialist doctor for an accurate evaluation to avoid complications. Who shouldn't take losartan? For whom is the use of this drug contraindicated? Primarily, for those who have any type of allergy after taking the medication or who are allergic to any property or component of the drug. For them, the use of losartan is contraindicated. Also, for women of childbearing age during pregnancy, specifically in the second and third trimesters, it is not recommended to give losartan because it can cause malformations and spontaneous abortions. People with kidney damage are also contraindicated for the use of losartan. That's why it's always recommended to see your primary care physician to verify if you are suitable to take this medication. People with severe liver failure or liver damage are also contraindicated. Children under 6 years of age are also not allowed to use losartan. People with diseases that cause high potassium levels should also avoid it. The use of sartans is completely contraindicated because they can cause further harm by contributing to elevated potassium levels. Therefore, it is very important to consider all these clinical manifestations when consuming not only sartans but also other medications that can also be harmful or whose use may be contraindicated. What are the advantages and disadvantages of consuming sartans? Well, first, let's mention the advantages. It is a very accessible drug, readily available in most pharmacies. It has a very low cost, which directly makes it one of the most affordable medications on the market. It is a first-line medication against high blood pressure, which is very beneficial because we wouldn't have to look for alternatives unless the person has an underlying condition that prevents them from taking this medication as a contraindication. As for the disadvantages, many people may experience adverse effects or much more serious side effects. While others may have similar side effects, Not everyone experiences the same side effects, as each body is very different. So, when considering the side effects and how to take Losartan, firstly, this is an oral medication that comes in different strengths, both 50 mg and 100 mg. It is recommended to take 1 pill a day, regardless of meals, but always under the supervision of a doctor. What happens if I forget to take my Losartan? Many people forget to take their medication in their daily routine. Since this is a lifelong medication, it is recommended that if you forget to take your medication one day, you do not take a double dose the next day, as this can cause side effects. Also, you should avoid making this a habit. By forgetting frequently, you can prevent the medication from having the desired effect in your body. With this brief explanation about Losartan, I'll say goodbye to this nice video. I hope this information has been helpful, and if you liked this video, please give it a like and subscribe to the page for other relevant and informative videos. My name is Dr. Taj Aguilar, and this is the SibTaj Project. Thank you very much.